Hello everyone. Today in my podcast I'm going to talk about the impact and limitations of telemedicine in modern healthcare industry. Today I will be talking about a new technology in healthcare industry called telemedicine. Telemedicine uses communication and information technology to deliver medical services remotely to anywhere around the world. It allows patients to consult healthcare professionals such as doctors, surgeons, and nurses using digital devices like video calls, voice calls, mobile applications, and online patient portals. The main purpose of telemedicine is to increase access to healthcare to people that don't have easy access to healthcare and provide efficient and reduce the need of physical hospital visits. Telemedicine can be both beneficial for the patient and for the healthcare professionals. Telemedicine works with safe internet connections that help real-time communication between the doctor and the patient. Common ways of telemedicine issues included virtual consultations, virtual diagnostic, and remote mental health support sessions, as well as online prescription services. And also, telemedicine can help with medication that we buy from pharmacies, and it can bring our medicines to our doorstep with delivery options without going anywhere. The technology has become increasingly popular during the last 10 years, especially during the COVID-19 pandemic. And now it's considered one of the most important modern healthcare technology and the key trend in modern healthcare ICT industry. There are many reasons for selecting telemedicine as my individual showcase topic, but among them, telemedicine's rapid growth and strong relevance to technology was one of the main reasons that I chose telemedicine as the topic for this podcast. Telemedicine explains how digital technologies such as cloud computing, AI, also known as artificial intelligence, and mobile technology are transforming traditional healthcare systems from their early adaptation. This topic will be presented as an audio podcast to provide engaging and informative explanations that can be easily understood. The podcast will explain how telemedicine works, technology behind it, advantage over the traditional healthcare systems, and its limitation or its disadvantages, and the future of telemedicine. So let's talk about how telemedicine works. Telemedicine works by connecting patients and healthcare professionals such as doctors, surgeons, and nurses through digital communication platforms like WhatsApp, Gmail, or hospitals' own applications. Patients can use their smartphones, tablets, or computers to access telemedicine services through website or mobile applications. These platforms allow video calls, voice calls, live chats, and those platforms help patients by sharing medical records with their doctor. Healthcare professionals can check their patients' symptoms remotely through video calls, voice calls, and provide diagnostics, treatments, and also recommend prescription medicines through the digital platform. In some cases, wearable devices and monitoring tools tell doctors real-time data of the patients such as blood pressure and heart rate pressure. These systems enable daily care without going to in-person doctor visits in the hospital or requiring any in-person visits with the healthcare professionals. Let's talk about key technologies used in telemedicine. There are different kinds of technologies used in telemedicine. Several ICT technologies already support these new telemedicine services. High-speed internet and cloud-based computing allow secure storage and safe personal data to transmit between the doctors and their patients. Video conferencing tools such as Microsoft Teams and Zoom enable real-time communication between the patient and the healthcare professionals, while AI, also known as artificial intelligence, assists in medical image analyzing and symptoms checking is becoming more and more popular. But AI can make mistakes, so it is not very reliable. On the other hand, electronically stored health records allow doctors to access patients' history, remotely and provide accurate treatments from anywhere around the world. Mobile health applications such as Apple Fitness, Google Fits, and wearable devices like Whoop support remote monitoring and making telemedicine a highly digital healthcare solution. So let's talk about differences between telemedicine and traditional healthcare services. There are many differences between telemedicine and traditional healthcare services. Compared to traditional healthcare services, telemedicine offers great convenience and accessibility to any person in the world to connect with any doctor in the world without stepping out of their comfort zone or their personal space. And patients can receive remote medical advice without traveling long distance to hospitals, which is very helpful for people in rural areas. Telemedicine also reduces waiting times in hospitals and overcrowding in hospitals, which can help patients with their medical situations. However, traditional healthcare still has its advantages. For physical examinations, emergency care situations, and complex procedures that may need surgeries. Those surgeries may require medical equipment that cannot be moved around. Telemedicine also works best as a support service to traditional health services rather than completely removing face to face healthcare services. And also, there is a huge impact on doctor patient relationship. Telemedicine can reduce genuine interactions between the doctor and the patients, which can feel not as personal. The lack of physical presence make it harder for healthcare professionals to pick up on subtle nonverbal cues and to establish the trust between the patient, which can distance the doctor and the patient. In terms of limitations and challenges in telemedicine, despite all of these benefits, telemedicine faces some limitations. One of the major issues that telemedicine faces is the digital divide, because not all patients in the world have access to reliable internet or internet at all, and the digital devices to connect with their doctors. Technical problems such as poor connectivity can affect the quality of their treatment and also result wrong treatments. There are also concerns related to data privacy and cybersecurity. If personal medical information is shared online, that can manipulate or harm the patient. Additionally, telemedicine may not be best for all medical conditions, particularly those requiring physical examination, emergency care. Legal challenges also can be varied between countries. In terms of the future of telemedicine, it's looking very promising with the advancement of artificial intelligence and virtual reality and remote diagnostic to expect improve its quality of service. Telemedicine has potential to become one of the most powerful and most important healthcare service in the world and to create more efficient healthcare system. In the global level, telemedicine has already become one of the most powerful services in the healthcare system because of its fast integration. In a third world country like Sri Lanka, it is very hard to implement these kind of systems because many people don't have access to internet or mobile devices. But in a global level, telemedicine has become very popular during the last 10 years. It's also mostly because of the COVID-19 pandemic. However, there are many considerations must be addressed including patient information confidentiality and data security, and also ensuring ethical implementation is essential. Finally, in conclusion, telemedicine is a new and promising trend in the healthcare industry that greatly demonstrates the impact of 21st century technology and modern medical services which can both help the patient and the healthcare professionals. While it offers improved accessibility, convenience, and efficiency, and also might reduce the loss of life, and there are many challenges related to technology access, security, and regulations must be carefully managed to protect the patient. Telemedicine is likely to continue and to get better and shape our future of healthcare as a digital innovation advance. And also, telemedicine can change our world hugely in the next decade.